Now we are moving on to the main part of the video, that is adductor compartment muscles, their attachments, their origin and their actions and their nerve supply. Everything we are going to cover in this single video. So let's start with the video. The first muscle which we are discussing about the medial compartment is our adductor longus. You can see it's a long muscle, right? So this adductor longus is actually a triangular muscle. It is forming the medial part of the floor of femoral triangle. So it's a medial part of floor of femoral triangle. You know, here the femoral triangle forms, right? This is apex of femoral triangle, this is the base. If you remember, the femoral triangle's medial part is bimedial border of the adductor longus muscle, right? And it lies in a plane of Pectineus muscle. So you can see this is Pectineus. So along with that plane only you have this adductor longus muscle, this one. So let us see its origin. It is arising from the narrow flat tendon from front of body of pubis in an angle between the pubic crest and pubic symphysis. So this is pubic symphysis, this is pubic crest. So you can see exactly the angle between the pubic symphysis and pubic crest at the rate of the body of pubis, you get the origin of adductor longus, right? So what is its insertion? Okay, let us come and you can see it is inserting into the linea aspera. You know, linea aspera is present on posterior surface of femur, right? In the middle 1/3 of shaft of femur between the vastus medialis and adductor brevis. So I will show how it is between the vastus medialis and adductor brevis and magnus. Let us see another diagram for that. So you can check out this diagram for the insertion of adductor longus. So it is attached to the linea aspera in a middle 1/3 of shaft. So this is a middle 1/3 of shaft. Actually this line is linea aspera will be middle like this, okay? So what they are saying, in the middle 1/3 of the shaft between the vastus medialis and adductor brevis and longus. So you can see this is actually in the diagram it's not shown, but here on the medial side will be attachment of insertion of vastus medialis muscle, right? And on the just side to it you will see the adductor longus muscle insertion here, right? And next to it only you will see, above you will see the adductor brevis insertion, and below you will see adductor magnus insertion. So that is what they are saying. Insertion of adductor longus is between the vastus medialis, adductor brevis and adductor magnus. Done. So now we'll move on to the adductor brevis. So if you see the adductor brevis muscle, it is a short muscle, right? It is getting its origin. And one more thing about adductor brevis, this muscle is lying behind the pectineus and adductor longus. So if you see adductor brevis, it is behind the pectineus, right? This is pectineus, so it is behind the pectineus and adductor longus. You can say this is adductor longus, right? So you can say nothing but adductor brevis is between the pectineus and adductor longus. It is getting its origin. Let us see its origin. It is from the anterior surface of body of pubis, and also from the outer surface of inferior ramus of pubis. Outer surface of inferior ramus of pubis. Pubis will have inferior ramus, right? You can see this is the pubic bone, this is the ischium bone. So this is the body of pubis, and below this one, this side is the ramus, inferior ramus of pubis. So from the inferior ramus of pubis, from the anterior surface of body of pubis, and also from the outer surface of inferior ramus of pubis between gracilis and obturator externus, and also from the outer surface of ramus of ischium between the gracilis and adductor magnus. So what you understood, that this adductor brevis is, you can say in a simple word that adductor brevis is getting its origin from both pubics and ischium, especially from anterior body of pubis, and also from the inferior ramus of pubis and from ischium ramus, right? So from there it is getting its origin, and it is getting inserted into the line extending from lesser trochanter. Let us see another diagram for insertion. So now we are talking about adductor brevis insertion. So actually here is the lesser trochanter. So actually they are saying that this is inserted from the line extending from lesser trochanter to the upper part of linea aspera, right? Behind the upper part of adductor longus. So just behind adductor longus, if you see, there is insertion of adductor brevis, which is coming from the line of the lesser trochanter. You can see this is a lesser trochanter. From here it is coming to linea aspera, and here it is getting inserted. So this is adductor brevis. Just behind the insertion of adductor longus, it is getting it insertion, right? So next we'll move on to the Adductor Magnus muscle. So it is the biggest muscle. We already discussed it's a hybrid muscle, right? So it is the largest muscle of compartment because of its double nerve supply, and it is also called as hybrid muscle. So let us see its origin and insertion. You can see Adductor Magnus here. It's getting its origin from inferior lateral part of ischial tuberosity. So here's the ischium and here's the ischial tuberosity. So from the ischial tuberosity it will get its origin, and also from the ramus of ischium, and also from the lower part of inferior ramus of pubis. So you can say simply that Adductor Magnus is also getting its origin from both pubis and ischium. So even our Adductor Brevis is also getting origin from both pubis and ischium, whereas Adductor Longus is special that Adductor Longus is getting only its insertion origin from the pubis, right? That too especially from pubic crest, the angle from pubic crest and pubic symphysis, that is from the body of the pubis. So our Adductor Longus is getting only origin from the pubis, but all the adductor muscles like Adductor Magnus, Adductor Brevis, all these are getting origin from the different parts like both pubis and also ischium. So this is about Adductor Magnus, and now let us see insertion. So where this Adductor Magnus will get its insertion. So Adductor Magnus is inserted into the medial margin of gluteal tuberosity. So if you see the gluteal tuberosity which is present there, it will get its insertion, and also into the linea aspera, and also into the medial supracondylar line. This one, this is the medial supracondylar line here, and also into the adductor tubercle. Actually adductor tubercle will be situated here. So all this are the insertion points of our Adductor Magnus. So you can see here also in this diagram Adductor Magnus insertion. It is inserted from the medial margin of gluteal tuberosity. So this is gluteal tuberosity, just medial to it there is a margin, so there also it will get its insertion, and also to the linea aspera, and also to the medial supracondylar line, up to the medial supracondylar line, and also up to the adductor tubercle. So this is all the insertion of Adductor Magnus. So you can say just behind the Adductor Brevis you will get the insertion of the Adductor Magnus. So next we'll move on to the Gracilis muscle. So coming to the Gracilis, here you can see this is the medial muscle. So this Gracilis is getting its origin from the medial margin of lower half of body of pubis. So only from the pubis, especially on the medial margin, lower half of body, and also from the inferior ramus of pubis, and also from adjoining part of ramus of ischium. So now we can say that even Gracilis in total, it's getting its origin from both pubis and ischium. So from there, this Gracilis will go and insert into the upper part of medial surface of tibia behind sartorius, in front semitendinous. So actually the medial part, upper part of tibia will give insertion to sartorius. If you remember in previous video, we talked about the anterior compartment muscles there. So if you remember the medial part of upper part of tibia will give also insertion to our sartorius muscle. So here this Gracilis is between the sartorius back, and in front you have your semitendinous. So between the sartorius and semitendinous muscle you have the Gracilis muscle where it is getting its insertion. So after Gracilis, now we'll talk about Pectineus muscle. So Pectineus muscle is flat quadrilateral muscle, forms a part of floor of femoral triangle, right? So Pectineus is forming floor of femoral triangle. Adductor Longus is forming medial wall of femoral triangle, right? So Pectineus is getting its origin from pecten pubis. So this line is called as pecten pubis. So from pecten pubis it will get its origin, and also from upper half of pectineal surface of superior ramus of pubis. If you see, this is the superior ramus of pubis. So from there, and also from the fascia which is covering the pectineus. So this all are giving origin to Pectineus, and in turn this is coming and inserted into the line extending from lesser trochanter to linea aspera. So there it will get its insertion. Here in this diagram you can see. So this is the lesser trochanter, right? This is the lesser trochanter. As we already discussed, from the lesser trochanter one line will come and join the linea aspera. There is insertion of Adductor Brevis. So just in front of Adductor Brevis only there is insertion of our Pectineus muscle here. So these are all different muscles, their origin, insertion, and also their attachments, everything. And now we will also discuss some of the other points like relations of adductor longus, because there are some important relations which are related to adductor longus muscle, this muscle, right? So the relations are which are important are mainly anterior surface. So anterior to the adductor longus, you have the spermatic cord, you have the great saphenous vein with fascia lata, and also you have the femoral vessels and sartorius muscle. So this is very important to know. This is adductor longus. So just anterior to it you have spermatic cord, great saphenous vein with fascia lata, and also you have the femoral vessels and sartorius muscle. Coming to the posterior surface of adductor longus, it have adductor brevis. Of course you can see it here only. Posterior to adductor longus you have adductor brevis. You also have adductor magnus, and you also have the anterior division of obturator nerve and profunda femoris vessels. So these are the posterior relations. Coming to the lateral border, so this is medial side, so this is lateral side. Lateral border will be pectineus muscle, okay, if it is present on this side also. Medial border, of course, you have gracilis. So this is different relations of adductor longus muscle. Now we will also discuss what are the actions of this adductor longus, brevis and magnus. These all are powerful adductors of thigh. Adductors are nothing but they bring the thigh, for example this is thigh, so they bring the thigh towards the body side or the medial side, and they act mainly as synergist and posture controller, especially during walking. And these muscles can be tested by attempting to adduct the thigh against resistance and palpating these muscles. So when you adduct your thigh and you try to palpate them, it is very useful to palpate the adductor muscles. So especially if you see adductor longus, adductor brevis and upper part of adductor magnus, they all help in flexion of the thigh. So this diagram shows the testing of adductors of thigh. Just move the thigh towards your medial side of the body and you can just palpate those muscles which are present on medial side of your thigh. So lastly we will discuss what is the nerve supply of this. Of course everything is supplied by obturator nerve, but you need to understand like what is supplied by anterior division and what is supplied by posterior division. If you see mainly this adductor magnus, it is supplied by posterior division of obturator nerve, and all these others like adductor brevis. And one more thing about adductor brevis, it is supplied by both anterior and posterior division. For example, if adductor brevis is first supplied by anterior division, then it will be not supplied by posterior division. So like that, either one will supply, like either anterior division will supply or posterior division, but both will not supply, okay. Coming to adductor magnus, it is supplied by posterior division of obturator nerve. Adductor longus by anterior division. Gracilis by anterior division. Pectineus by anterior division. So one more thing about adductor magnus, it's a hybrid muscle or composite muscle supplied by posterior compartment, that is sciatic nerve, and also by obturator posterior division. And even pectineus is a hybrid and composite muscle because it is also supplied by two nerves. One is the femoral nerve, that is the anterior compartment nerve, and also the obturator nerve, especially is anterior division, okay.